5 on your health this morning, scanning your body for skin cancer. You may be skipping some high-risk areas. Here to explain is Dr. Samir Gupta of Mass Eye and Ear. Doctor, thank you so much for joining us this morning, making a house call for us. We appreciate it. First, let's talk about what we should be looking for.
Absolutely. I always counsel patients that you should do monthly skin checks on yourself. And what are you looking for? You're looking for any rough lesion, any sore that's not healing, any changing freckle or mole that you might have. We always talk about the A, B, C, D, E's of melanoma. That's an acronym. A is for asymmetric. B is for border irregularity. C is for color variation. And D is for diameter greater than 6 millimeters. And that's sort of the size of an end of a pencil eraser kind of size. And then E is for evolution. So that's probably the most important one. Anything that's changing, those are the types of signs that might prompt you to go talk to your doctor.
I think we tend to maybe really pay attention to our face, those places that are exposed so much to the sun. Are there places people should be checking though, but they don't?
Absolutely. So first of all, the number one risk factor for skin cancer is sun exposure. And of course, the face, the head and neck, these are areas that get lots of sun exposure over the years. And those are common places where skin cancer develops. But you can develop skin cancer anywhere you have skin. And so when you do these skin checks, you kind of want to look at other areas such as the hand, the nails. You can even get skin cancer on the bottom of your feet. So these are areas that you should be conscientious of.
We apply sunscreen, hopefully, to those places that are exposed to the sun so much, but some of those places that you just mentioned, not as easy. What do you tell your patients about covering up?
I tell my patients, change what you can change. And basically, UV exposure is the most modifiable risk factor. So definitely wear that sun protection. That's clothing, that's SPF 30. Reapply every 2 hours. You can put it on your feet. People forget about that. But full body application typically takes about an ounce of, 1 fluid ounce of sunscreen. And then also avoid tanning bed use. When you're out at the beach, try to cover up. These are the types of things that can help you avoid skin cancer.
We like to think that we lather up and cover everything up. It is August, of course, but we talked a little bit about this. Like if I'm just running outside to do something quick in the yard, 10, 15 minutes, I don't necessarily cover everywhere with sunscreen. Is there a safe amount of time you can spend outside without putting anything on?
So there's no specific amount of time that's safe, but what I always tell my patients is to wear sunscreen every day, make it part of your routine, because of course you'll forget if it's not part of your routine, and you will get this intermittent sun exposure when you're not thinking about it.
Okay, good to know. Dr. Samir Gupta of Mass Eye and Ear, we appreciate you coming in so much, and thank you for all of the advice.
Thanks for having me.
Thank you very much. Have a nice weekend.